Determine HIV Early Detect is an in vitro, visually read, qualitative immunoassay for the detection of antibodies to HIV-1 and HIV-2 and the detection of non-immunocomplexed HIV-1 P24 antigen in human capillary and venous whole blood, serum or plasma. Each Determine HIV Early Detect kit contains Determine HIV Early Detect test cards in a foil pouch and a desiccant package. Also available are disposable capillary tubes and sterile lancets for collection and transfer of fingerstick samples and chase buffer used for whole blood samples. Determine HIV Early Detect test cards must be stored in the pouch at 2 to 30 degrees Celsius or 36 to 86 degrees Fahrenheit until expiration date. To perform the test, you'll need a package insert, disposable capillary tubes, a sterile lancet, a biohazard waste container, sterile gauze, antiseptic wipes, a timing device, disposable gloves, and chase buffer. Open the foil pouch and remove a test card. Remove the desired number of test units from the test card by bending and tearing at the perforation. Return and store the unused test units in the foil pouch together with the desiccant package. Carefully close the pouch by pinching with your fingers to seal, so the cards are not exposed to ambient humidity during storage. Remove the protective foil cover. The assay should be initiated immediately after removing the protective foil cover from the test. Place the test on a flat surface. Clean the patient's finger with an antiseptic wipe. Allow the finger to dry thoroughly or wipe dry with a sterile gauze pad. Use a sterile lancet capable of producing 50 microliters of blood. Twist off the protective cap. Press the lancet firmly against the skin just off the center of the finger pad to puncture the skin. Wipe away the first drop with sterile gauze. Avoid squeezing the fingertip to accelerate bleeding. Squeeze the body of the capillary tube and bring the open tip to touch the blood. Slowly release pressure and collect blood to the fill line exactly. Filling is not automatic. Do not press the finger with the capillary tube. If more blood is needed, apply pressure or squeeze the punctured finger to draw more blood. Collect the blood exactly to the line, not lower volume and higher volume. Place the capillary tube containing the blood sample onto the middle of the sample pad, marked by the arrow symbol at an upright vertical position. Squeeze the body of the capillary tube and apply all blood to the sample pad. Wait for 1 minute. Hold the bottle vertically and apply 1 drop of chase buffer to the sample pad. Discard the used capillary tube and any other test material into a biohazard waste container. Read the test result between 20 and 40 minutes after the addition of the sample. Do not read the results after 40 minutes. Interpretation of test results. Antibody reactive. A red control line appears in the control area and a red antibody line appears in the lower test area of the test strip. The intensity of the antibody and control lines may vary. Any visible red line in both the control and lower test areas, regardless of intensity, is considered reactive. A reactive test result means that HIV-1 and/or HIV-2 antibodies have been detected in the specimen. Antigen reactive. A red control line appears in the control area and a red antigen line appears in the upper test area of the test strip. The intensity of the antigen and control lines may vary. Any visible red line in both the control and upper test areas, regardless of intensity, is considered reactive. A reactive test result means that HIV-1 P24 antigen has been detected in the specimen. Antibody and antigen reactive. a red control line appears in the control area, and a red antibody line appears in the lower test area, and a red antigen line appears in the upper test area, the intensity of the antigen, antibody, and control lines may vary. Any visible red line in the control area, the lower test area, and the upper test area, regardless of intensity, is considered reactive. Non-reactive. A red control line appears in the control area of the test strip, and no red antibody or antigen line appears in the lower test area and the upper test area of the test strip, respectively. A non-reactive test result means that HIV-1 or HIV-2 antibodies and HIV-1p24 antigen were not detected in the specimen. Invalid result. No control line. If there is no red control line in the control area of the test strip, even if a red line appears in the lower test area or the upper test area of the test strip, the result is invalid and the test should be repeated. If the problem persists, contact technical support.